The program is an easy program to navigate and very simple to register for. There are two ways to register, and the first one is by calling the phone number that's on your screen, and that's 1-866-50-CHECK. But the easiest way to register is by going online at the aging.maryland.gov website. There are four buttons that come up at the top. Click on one of the four, you'll see the senior call check button, and will produce this screen. Along with this screen, you can scroll down and it'll have a note, it will say register online. We ask you 15 simple questions. Obviously, first is going to be your name. It's going to be your telephone number, because the way the program works, as you can see on your screen, is through a telephone. We make a phone call to you every single day. That message changes every single day as we give information on COVID-19. We also provide a resource for folks that are having some difficulty, and that is the MAP link phone number that the department has set up with all the area agencies on aging across the state. There are 19 of them, and it goes to 1-844-MAP-LINK. So if senior will hear that on the message, and if they have additional needs, they can call that. They will get a warm handoff to the local area agency on aging. So in Baltimore City, that would be the Baltimore City Health Department, Baltimore County, the Baltimore County Department of Aging, et cetera, right on through all of the jurisdictions and subdivisions in the state. The great part about it is it's statewide. We asked the 15 questions, and one of the questions is we want an alternate person. However, it's not a barrier. If you don't have an alternate, we assign you an alternate. But we ask for an alternate. We ask for that alternate's phone number. And here's how the program works. Each day we call you. If you don't answer, we'll call a second time. If you don't answer, we'll call a third time. You get to pick the time that you want us to call. We call between 8 and 9, 9 and 10, 2 to 3, or 3 to 4. The participant chooses the time they're going to want that call, and that call will come every single day during that time period. If you don't answer the call in the first 3 call rings, we call the alternate, and then we notify the alternate that you have not answered your phone. If in fact the alternate doesn't answer their phone, we will call back and ask the alternate a second time and notify them that you did not answer your phone. If in fact the alternate doesn't answer, we'll send the number of the participant to the local non-emergency 911 phone number in the local jurisdiction. And one of the questions that we asked is, which county are you living in during the registration process, whether it's online and or the phone. Depending upon how you answered, if it's Dorchester, if it's Wycomico, if it's Allegheny, we'll send it to the non-emergency number in that county, and that county will go out and do a welfare check. And so that's pretty simple how the program runs. It's similar to a button around our neck that we'll put on as a PERS, personal emergency response system. However, this one doesn't cost anything, and it's not as, it's not as, I don't think, as wonderful as a emergency response around your neck, but it certainly provides comfort to someone who does not have one.
Well,
so
that's
pretty
awesome,
much the
Arnold.
program.
That's awesome, Arnold. And actually something that you stated that I wasn't familiar with, that I actually almost feel like is one of the best aspects of this program, that you said that there's a message every day talking about developments on COVID-19 to the participants.
It'll give them the message. It changes daily based on the changes that may be happening daily. We'll also give safety tips, and those safety tips change every day. So we have about 30 different messages right now in the can, but that's fluid. We will change them as we need to.
What an awesome, I mean, just that aspect of it for those people, and they're our clients. We know they're homebound. They don't have access to technology. They've got and again, I'm drawing stereotypes. They got the old fashioned phone, but they could have a cell phone, but just that reminder, but the message and the tips are absolutely awesome. You know.
And everybody has a phone. So this program works for all older adults.
That's great. Okay, just before I get to introduce another panel member, I want, there's a couple of comments. Somebody had said that they want to ask a question. Oh, actually, we've got a couple hands raised. So I'm going to kind of jump through these. And Kevin, I believe you've got a meeting coming up, right? That you're going to have to jump off of.
1 o'clock. I'm good until 1.
Okay. All right. But I tell you what, I'm gonna call on you next. Okay. But let's talk to a couple of other participants before we do that. Okay. Jill Rosner, who's an aging life care manager, right? Jill? Jill? Here. Oh, come on. Jill, can you hear me? Like I said, guys, we're going to have technology problems here. Okay. So I'm clicking the unmute for Jill. Jill, I called on you, so if you unmute and you start talking, just jump on. But let me introduce another panel member, and that's Kevin Heffner with Mid-Atlantic Lifespan. I still want to call it Mid-Atlantic Lifespan, but Lifespan. Kevin, we were supposed to meet at your conference center today. So thank you for agreeing to host us, and I can't wait to get back there. But tell us a little bit about Lifespan and what's going on with your members. What's happening?
Well, good afternoon, everyone. Happy to be able to be part of this. Thanks to Steve and to the other panelists for including us. You know, we'd love to have this meeting taking place at Lifespan, as Steve indicated. I will say kudos on the backdrop, Steve. I love the use of the technology. My wife was on a Zoom call yesterday, and one of the panelists had a volcano in the background, and they were talking about all the concerns, and I said, you have more immediate concerns. You need to worry about the volcano that's going out off behind you. It's been a busy couple of weeks for all of us. Busy couple of weeks for all of us. As many of you know, Lifespan is the largest senior care provider organization in Maryland and represents the entire spectrum, ranging from hospitals to nursing homes to assisted living providers and home and community-based services. We have all sorts of members and providers who are stakeholders in our organization. And when the governor called us to a meeting a couple of weeks ago, that was the first sign, at least from my perspective, that things were going to be happening very quickly, and they have, as you all know. We've been in regular communication with the governor, Secretary Kramer, Fran Phillips on a whole variety of issues, but I'll just sum them up in 3 basic buckets that we've been focused on. The first is supplies. The second is staffing, particularly nursing staffing, and the third is overflow, and I'll address them all very quickly. First, in terms of supplies, obviously PPE has been on everyone's mind, and we've been doing the best that we can to connect our members and all comers to resources for PPE. We had the fortune of connecting with Goodwin House in Arlington, Virginia, in the past couple of days, who connected our members to additional available supplies for those who were trying to get hold of N95 masks and gowns and gloves, and made that connection for a couple of folks. We've also been actively engaged with McKesson and Medline as the distributors that many of you use to leverage additional resources. What the state has told us, and what we're telling our members every day, is that regional collaboratives are the best resource beyond the local distributor that you use for additional supplies. We're also beginning to connect with independent suppliers, both here and abroad, to try to leverage additional resources and to get you the supplies that you need. That's in our daily communication, and I'll mention this again, but if you'd like to be added to that distribution list, please let us know. We'll take all comers and make sure that you get the communication that we're sharing from the Department of Aging, from the Department of Health, and others. Secondly, related to staffing, one of our members shared with us last week that last Monday, the first day that schools were off in Maryland, was the largest volume of call outs that they had ever experienced. People were trying to figure it out, what to do with school-age kids so that they could get to their jobs. Obviously, things have progressed from that point. The governor has opened all sorts of avenues to getting caregivers into jobs in facilities in Maryland, allowing people who are certified in other states but not Maryland to work, people whose certifications have expired to be able to work. And now we're working, I'm a member of the Governor's Workforce Development Board. Obviously, a large number of people who have been laid off or have been let go in Maryland in other fields, and we're attempting to create a bridge to fast track getting them into nursing positions as quickly as possible, to try to speed up the certification process. So that's what we're engaged in related to staffing. We also have daily communication on childcare. You probably know this already, but if you don't, if you are essential personnel, there are childcare resources available to you that are not available to everyone else. And so when the announcement was made broadly that childcare was closing, there was a panic that, you know, I'm essential, I need to be able to get to work. And so we've got a whole variety of resources through the state that we're sharing so that you're able to do that. And then finally, as it relates to overflow, we've been in regular communication with the Department of Health and others around making additional CON availability within skilled nursing facilities for overflow from hospitals, anticipating that surge. We've also had some communications back and forth about assisted living providers who are either just opening and vacant, or have wings or sections that can be used. And so we're doing everything that we can to leverage those resources in advance of the surge so that the state has as many resources as possible, in addition to the things that you've heard talked about in the media, ranging from the convention center to stadiums and that sort of thing. Assisted living is in my opinion, more equipped to be able to do the care that needs to be provided if we can make those resources available. Again, just a quick mention, we're providing daily emails to our members and constituents on all three of these big issues. If you'd like to be added to the list, Steve knows how to get in touch with me, with us. We'll make sure that effective tomorrow, you'll start getting that regular communication with us and have all the information that we have. But I just want to thank, you know, Arnold, Department of Aging, Department of Health, the governor's office have been as transparent as could possibly be expected on getting information out to the associations that represent providers, and so that we can be in touch with each other. Lifespan, HFAM, Leading Age Maryland, we're all sharing resources. And I guess one of the silver linings in all of this is that we're being forced to be more communicative and more collaborative, and we've done that, and it's really been a good thing.
Awesome, thank you, Kevin. These are great resources, great thoughts. And while you were talking, Sterling Assisted Living in Pikesville put in a comment that they have 4 beds that they would love to designate to overflow. So I think it's very timely, and I agree. It's like, it would be much better to fill up these empty beds in assisted living than going to the convention center and having somebody, you know, sleep in a big ballroom or something of that nature. Let me, before I bring on another panelist, let me address or throw out a couple of questions that are coming from the folks. This one's for Arnold. Arnold, does the automated system also call on holidays? An earlier version of the program did not call on 6 holidays.
There are still, I think, 5 holidays that it does not call on. I also know you have a question about TTY, and one of the 15 questions that we ask is if you are a TTY user, and if you answer yes, then it goes to a TTY operator on a daily basis.
Okay, awesome. Let's see, another question about call check, integrating with the villages. It sounds to me like it's totally agnostic. Anybody in Maryland can join call check. So whether you're in a village or not, it
I would
doesn't
say
matter.
anybody in a village, the village coordinator should let everybody know to join it. And that's how this has, grown. We're at as of today, I think close to about 800 folks that have joined Senior Call Check.
Yeah, and this is awesome. And I think, Arnold, you mentioned to me, there's a lot of things, a lot of great ideas that are out there that we've been talking about for years, okay, that we couldn't launch, all right? And now all of a sudden, now we're even more isolated in this crisis. But what's great, the silver lining is that good programs like Senior Call Check, in a perfect scenario, would maybe have a couple hundred people. You got 800 now,
Yeah.
overnight. So
yeah, because it's really, now everybody's like, hey, maybe I do need that program.
yeah, exactly. Okay, so let me see. I want to make sure that this hand raising can work. So Evelyn Shiner, let me see if I can get her on. Evelyn, can you hear me? Evelyn? I hate this. Okay.
Can you hear me
now? Ah, Evelyn.
Yes, hello.
We can hear you. Awesome.
Wonderful. Great.
Do you have a question or a comment for us?
Well, I was just, you mentioned about our assisted living where we have some vacant beds that we'd like to offer to take care of people that need to be discharged but have nowhere to go. My concern is for the safety, of course, of my staff and the rest of my residents. My idea would be to require a negative COVID test and chest x-ray within 24 hours of discharge, and then isolate them for 14 days before adding them to the general population. Does that sound like a reasonable way to handle it?
This is one of the great reasons that we got Dr. Amy on the call.
So just to address your issues. So number one is going to be how to get those things. I actually think your idea sounds very reasonable. I mean, it's certainly very conservative, and it would protect you pretty well, assuming that that person was also quarantined and wasn't having additional exposures. So one of the things you might consider doing is a couple things. Number one is figuring out who that patient's primary care doctor is, because that's not going to be an easy, what you just described is not an easy workflow. Like how to get an x-ray, how to get a COVID test on a patient who's now homebound, potentially bedbound. It's not like they're going to be going out to the drive-through.
Excuse me for interrupting. I was thinking more of people that are currently in the hospital who are ready to be discharged.
Yeah.
That's, the little old lady who broke her hip and is now done with rehab and needs to go home and can't go. Where is she going to go?
Yeah, so just to clarify then, you're proposing that she goes home for 14 days?
No, that she can be transferred to us directly from the hospital.
In your facility.
Right.
For 14 days in like a quarantined-like environment.
Yeah.
I mean, I think we can talk about that offline, but again, I think gathering resources as you've described is not that easy in this in this time. I mean, there are organizations that are doing chest x-rays remotely. I mean, not remotely, but mobile. And there are organizations that are sending out people that can do the COVID testing. But
well, I've actually had experience with that already, because one of our residents did come down with an upper respiratory condition presenting with symptoms consistent with COVID. And I could not get a COVID test done on her by her doctor. He refused to do it.
Right.
And I called the health department, and they said that now that people in long-term care facilities no longer need a doctor's order in order to get the specimen processed. So I had a doctor in the community who gave me the swab kits, And I went ahead and got the test and took it down to the health department myself to make sure that what this person had was or was not, in fact, COVID. Unfortunately, she expired last night, and I was glad I was able to get the test beforehand. Hopefully by the end of today, we'll get those results. But in the meantime, that's the kind of stuff I've had to deal with. We do have an X-ray company, at least as of last week, who was coming out to take chest X-rays. It's been a challenge, and trying to get cooperation from different medical people has been a little bit challenging.
Yeah, there is no doubt. I mean, I think we're in a period of very rapid pivot as it pertains to medical practices. I mean, just a brick and mortar internal medicine practice is right now, they're probably seeing 20% of the patients in their office that they typically see, and all 80% of the rest of their visits are all being done using telehealth or telemed or whatever you want to call it. In terms of people coming out to do the test, again, there's a lot of operator issues that can be very important for COVID testing. Specifically, if you don't get far enough back in the nasopharynx, you could actually simply get the wrong answer because you didn't get the sample done correctly. So I would argue that just regular Joe Blow, I don't think Steve Gurney's going to be doing a great, COVID test on me. Like if I were to give you a swab, I don't know that you would necessarily get it done right. No offense, but none taken, right? But I think the issue is, making sure that there's an operator issue, and that understanding that these results, as they get better and better, the sensitivity and the specificity of the test certainly is very important, but understanding, well, okay, they got a negative result. What does that really mean, especially if they're symptomatic? And there's just a whole lot of nuances, and I'm happy to discuss these particular cases offline, and you can reach me, and I'll tell people how to reach me at the end. But I think it is going to be troublesome trying to figure out how to make sure that if you do bring somebody into your community, I think your point is well taken, that they are not in fact going to then spread anything terrible to the rest of the community. It is a challenge, and I'm not sure that there's a 100% guaranteed way of doing that.
Yeah, and thanks, Amy. And one of the things that we've discovered on these calls is we raise a lot of questions, and right now we don't have a lot of answers. But one of the ways to look at these webinars is it's like a support group. We gotta raise these questions. We're gonna have the answers at some point. But I like the way that you're thinking in your community, and just be diligent and share whatever you learn with the rest of the community. And to that end, many of you have joined already, but we have the ProAging online community, which enables a very free sharing of discussion 24/7 on these topics. So if you're faced with a challenge, you can make a post and other people can kind of jump in and give you feedback. Let's see. Let me introduce another. Okay, so and Amy, tell everybody, kind of just give a little bit of your background. Tell them about your podcast, what have you.
Okay,
and then I'd like to introduce Grace.
Okay. So just quickly, some of you probably know me as the former medical director of a fairly robust house calls practice that served a good part of Maryland, DC, and Virginia. I've since not doing that anymore, but I'm still in the home care space. With a partner of mine, we have started a podcast called Mastering Medicare. You can find us on Spotify and Apple. The whole point of the podcast is to help educate senior serving professionals as well as providers on how Medicare works, because we've identified over the past many months and many years that I've been doing this, that failure to understand Medicare is a source of profound system dysfunction. So you can listen to the podcast, and we'd be very happy to have you listen to it. Additionally, I am working really closely with lots of medical providers in the area on two specific things that have to do with technology, which have become incredibly relevant in the past 2 years, and they are telehealth, telemedicine, and remote patient monitoring. I'm happy to talk to anybody offline about any of those things if they're interested.
And I think, Amy, you mentioned that we're going to do a webinar next week on remote patient monitoring.
Yep,
so
we are.
You'll get everybody on this. We'll get an invite to that one too.
Yep.
The other thing that I want to mention is that the slide deck that I'm about to show you that Grace has and that had Arnold's info, I'll send that out immediately when we're done, along with a link to the recording of this. Before Grace goes on, a couple of really good comments. Somebody asked, is there a program like Senior Call Check in other states? And if you look in the comments, somebody did share a link to a similar program. So if you're in Virginia or DC or somewhere else, you might be able to get something similar. Somebody asked, where do medical professionals look to see if they're eligible for child care assistance? Does this assistance also apply to home care workers? Can any of the panelists comment on that? If not, I'm sure one of our attendees can answer that question. Anybody know the answer to that? Where you get child care assistance? Kevin, I think you mentioned something about child care assistance.
Yeah, there's a link that I can send that provides a pretty detailed listing, and it's from the state. So it identifies who is eligible, who's not, and it's free.
In creative ideas, and again, this is something that to talk to your employers. I'm pretty sure they're a member of your lifespan, but Farney Keedy, I noticed they created an off-site childcare center for their workers during this challenging time. And so getting creative with your employers, you know, there might be some solutions that you guys can, that we can all come up with, but make sure you share it with us. So, okay, Grace, tell us, you're with the Maryland Department on Aging, but tell us a little bit about what you want to talk about today. And I've got the slide deck, I can pull it up.
Perfect. Thank you, Steve. First of all, thank you for having me. As you said, I'm Grace Fielhauer. I'm the director of the Maryland Community for Life program for the Maryland Department of Aging. I'm going to speak with you today about the Maryland Community for Life, or CFL program, and how it can help adults age in place. So Steve, if you wouldn't mind pulling up those slides. Great, thank you. So as you all know, Maryland is well into a period of massive growth in the older adult population, both the number of older adults and their share of the total population. Currently, many of these older adults live at home until they fall, are defrauded, or experience another calamity that makes higher level of care a necessity. They then spend down, typically within 2 years, until they are impoverished and Medicaid eligible. The Maryland Community for Life program seeks to change this trajectory. CFL is designed to address the predictable problems of aging, to help older adults live independently in their own homes, healthy and engaged, while avoiding the expensive cost of nursing home or assisted living care. To provide CFL services, the Department of Aging partners with a nonprofit agency with experience serving older adults in their community. This nonprofit provides CFL services within a defined geographic boundary, typically countywide. 3 services define the Community for Life model: home maintenance, service navigation, and transportation. A CFL member's home maintenance service begins with initial home safety inspection by a trusted community handy person employed by the nonprofit partner. This handy person will identify any safety issues in the home, such as the need for railings between the bedroom and bathroom to prevent falls at night, or a broken lock, and make the necessary improvements. In addition to this home safety inspection, CFL members are entitled to a set amount of home repair services per month, typically 4 hours. These repair services include tasks such as changing light bulbs, cutting down tree limbs, and replacing smoke detector batteries. Routine home maintenance helps older adults stay safe, prevent falls, and maintain the value of their most valuable asset, their home. Additionally, the Community for Life home maintenance service helps to prevent older adults from being defrauded. Fraudulent home repair contractors target the older adult population. The outcome can deplete their life savings. CFL members help to prevent this type of fraud by assisting members with large home maintenance projects such as roof repairs and electrical issues. In these cases, the CFL provides the member with a list of vetted contractors. When a member has selected a contractor, the service navigator reviews the proposal on the member's behalf to ensure the contract is fair and reasonable. You can move to the next slide, Steve.
Oh, sorry.
No problem. The next core CFL service is service navigation. Each CFL is required to hire and train a local service navigator. The training to become a service navigator is extensive and has been designed specifically for the Maryland Community for Life program by McDaniel College. This individual becomes an expert on all of the programs and services for the older adults in their area, and thus an excellent resource for CFL members. Service navigators can provide advice on topics ranging from local events to fraud prevention. Additionally, service navigators are tasked with contacting CFL members on a regular basis. This proactive communication allows service navigators to identify issues that make living at home difficult, such as isolation, and find suitable solutions. Next slide. The final core service is transportation. Each Community for Life provider offers a fixed amount of transportation to their members each month. These transportation services allow older adults to complete tasks such as food shopping, errands, or attending medical appointments. Additionally, transportation services provide CFL members with access to community, cultural, and family events they might otherwise be unable to attend. As I mentioned previously, the Department of Aging partners with nonprofit agencies to bring these services to Maryland residents. The Department of Aging provides a portion of the initial seed money for each Community for Life, but local programs are required to be financially self-sufficient without large resources from state government. CFL services are funded in the long term through membership fees, nonprofit contributions, and in some instances, local funding. Older adult participants in CFL pay a monthly membership fee. This membership fee is far less than the cost of procuring these services individually. Additionally, each Community for Life has committed to providing scholarship for residents who can't afford the full membership fee. There are currently 6 Communities for Life operating in the state of Maryland. They serve Allegheny County, Baltimore City, Baltimore County, Talbot County, Wacomico County, and Worcester County. Our goal at the Department of Aging is to expand these CFL services to every Marylander. To that end, if you're interested in additional information regarding the Community for Life program or becoming a CFL provider, I would ask that you please email me at communityforlife.mdoa@maryland.gov, and I'll also send you guys a message with that. But thank you for your time, and I'd be happy to answer any questions you may have.
Awesome. And I mean, again, I'm really charged up to learn about all these Department on Aging programs that are out there in Maryland, and I know the attendees are as well. So thanks, Grace. Let me, I see Julie's got her hand raised, so I'm gonna call on Julie here, but I wanna go through a few of these questions that folks are bringing up. Let's see, there was a good one here. Oh, here's one for Arnold. This is a question for Arnold. Is the Department of Aging reaching out to aging care manager community for helping with the call check program? Also, who is conducting the welfare check visits if unable to reach the senior?
Local counties are conducting the welfare check, and that's handled individually by each of the local counties. Each county has, as I mentioned, a non-emergency number that goes through their 911 center, and then they go ahead and dispatch out if, in fact, they may make some phone calls too and checks and balances and see if they can reach the older adult. The first part of the question is we've been reaching out to everyone to try to engage older adults and communities. A lot of communities have their own call check programs, whether it's a CCRC or whether it's a large senior community that has independent assisted and dementia care. Those communities typically have their own internal, they don't really need something called senior call check, but it's those that are living by themselves independently in the HUD buildings as well. We've sent out lots of literature out to the HUD buildings across the state to those 62 and over facilities. Even though the program's 65 plus, most of the older adults in the HUD buildings are over 65.
Great, thank you. This is a question, I don't know if any of the panelists can answer it, but I bet you some of our attendees can. I was certified as a home health aide in DC. My certification expired in October. I'd like to help. Who can I contact to get expedited certification to care for clients in Maryland? I don't know, can any of the panel members answer that? But I guarantee if you know the answer to that, type that into the chat. That's a very good question. let
I
me,
would say the Department of Health is the best resource for anything related to the coronavirus.
okay, great. Let me call on Julie Roth here. Julie, I am, Julie, can you hear? Can you speak? Whoops. Julie's hand went down, so maybe she was just, okay. How are the communities handling family visits as we enter into the third week of no visits allowed? Are scheduled supervised visits worth the exposure risk? We have put a schedule in place for FaceTime calls, but as this drags out, some of the adult children are starting to just show up and have parking lot meetings with their parent, especially in the independent living part of the community. Yeah, I know this is super challenging. And Kevin, I don't know if you've heard of any creative solutions that your members are accessing, but I would turn to the attendees too. If you're with a community and you've got a solution to this, raise your hand and I'd love to share, give you the opportunity to share with the group. Kevin, any thoughts on this?
Yeah, well, obviously there have been a fair number of creative approaches to this, and we've all seen on social media, I think the examples of one side of the window communicating through to the other side of the window, some of those heartwarming kinds of stories. But, you know, obviously the media that we all use, Skype, FaceTime, et cetera, but there are a couple of companies within our associate membership who are doing some really creative things, and I can share that with you, Steve, so you can share it with participants. Inexpensive and no-cost options for communities that we've shared and gotten really good feedback on the results that they've gotten. So I'll send that to you.
Okay, cool. I'm going to call on Cordell in a moment and Walter Fanberg, but a question for Grace. Is there plans to expand CFL to Prince George's County? Oh, and you responded already.
I responded to Caroline County. I haven't responded to PG yet. Yes, we are actively working with Prince George's County at this moment to try to bring Community for Life to their jurisdiction.
But what you're doing, in order to do that, you're looking for nonprofit partners, correct?
Yes, absolutely.
Okay.
So a nonprofit provider in Prince George's County interested in providing the services I described, please reach out to me. I would love to speak with you.
Awesome. Okay, so let me try to call on Cordell. Cordell,
yep. Can you hear me?
us? Yeah.
Okay, perfect. I work for a community in Bowie, Maryland, Tribute at Melford. And what we're doing there is virtual visits for family members. We knew that that was going to be a concern. So we don't actually allow visitors into the building other than EMS and staff. So all of our visits for family, we schedule it through our activities person. So literally each of our residents is able to use a device. We are with them when they're using the device if they need our help to enable them to virtually speak with their family members. Now, some prefer a conference call, others prefer virtual, whether it's Duo or whatever services are out there. But in the effort of trying to keep them all safe, we don't allow the family physically into the building. And we haven't since the governor, or I guess the CDC restrictions and WHO restrictions have kind of been in place. So we want to keep our residents safe. That's our primary goal. And so we've also incorporated the old like PlayStation, actually it's not PlayStation, I think it's Sega Genesis, handheld devices that kids used to play maybe 10 years ago. We've incorporated using those for our members, our residents, as just something for activities that they can do. Because for the most part, the kids have kind of moved on to the PlayStation 3, 4, 5, and 6 or whatever's out now. But those devices actually seem to work very well in terms of providing a comfort for a little while, but that's how we're handling the family part as it relates to visits.
Yeah, boy, you know, I never thought about, you know, whenever I would go to Goodwill and drop off all the old video games that my kids don't play anymore, they could have an entertainment value here. They're great games, especially if you've never played a video game. And
Exactly.
so, yeah, as long as those could be cleaned up and sterilized, that would be a great thing for families to do, to donate those. So thanks, Cordell. Let me I'm going to call on Walter Fanberg, Dr. Walter Fanberg. Known him for years. Glad to see that he's on the call here. Walter, can you hear me?
Hello, guys. This is on the virtual visiting. We've permitted no visitors like most facilities, and we've been absolute about it. I went through a number of different devices and finally found that iPads work about the best. They give people a pretty good view. iPad using FaceTime, Skype, or Google Duo has worked the best. All our residents obviously have dementia, so staff have become conversant in using these devices with the residents. We've been very strict with no visitors, even to the point of being concerned about the phlebotomists coming in and taking blood from our residents. My daughter Debbie, who's running the facility, wanted the phlebotomist not really to even come through the front door. But we've got a vestibule area. That's as far as we're allowing the phlebotomist to come in. So we've discontinued PT, OT. We're down to absolute essential visiting by professionals. And we're limiting that as much as possible. Our major vulnerability is our staff. Keeping our staff who may be exposed to COVID, keeping them from infecting our residents. That's our greatest fear. That's what's keeping me up at night. All of our staff are now wearing masks. I went through figuring out whether it's going to be N95s or surgical masks. Some of the staff feel better with the N95s. Some feel comfortable with the surgical masks. I see, and so all of our staff are wearing not only surgical masks, they're also wearing large eyeglasses, eye shields, which are large glasses. So again, we're not concerned about our staff getting the COVID from our residents, or our residents get. We're concerned about our staff communicating this bug to our residents. So we're beyond spooked and taking every measure that we can.
Well, thanks for sharing that, Walter. And Dr. Fanberg is the founder of Arbor Place, which is one of the first memory care assisted living in Rockville, Maryland. Let me go to Allison. It looks like Allison Berringer is the next person on the list. Allison, can you hear him? Can you hear us? Allison?
Yes. Can you hear me now?
Yeah, Allison, yeah.
Hi, thank you. Allison Berringer, and I'm with the Village of Rockville. So my question is, as COVID patients, our older adults are released from the hospital or happen to be convalescing at home with COVID-19, and this is probably for you, Kevin, are any of the home health companies working with them? And if so, what procedures are you taking?
Yeah, that's a good question, Allison. I don't have an answer. Maybe someone else can help answer that one.
Well, I'll tell you, on most of our webinars, there's been a representative from, I know there's home care agencies that are on our on this call that can answer, but another company that's been on a lot of these webinars is ShiftMed, and I know what the challenge that a lot of the communities and facilities are having is that their residents are sick and they can't go to work, And so the short-staffed in the communities, and I know ShiftMed is one of the companies that is providing additional human resources, and that they've got a screening for their folks. But that's a great question. Like I said, Allison, I mean, it's like we don't necessarily have the answer. I see there's a few home care agencies that are making comments in the in the comments section, but thank you for sharing that.
Thank you.
What anything else, like what's going on at the Villages of Rockville?
Sure. Well, you all may know we had a very early low risk exposure to COVID-19. We immediately took precautions and tested everyone that went to the memorial service, both residents and staff, and all tested, negative to COVID-19, and we remain COVID free at this time. Our staff is working super hard, as is everyone. So just real proud and pleased to see our response and how effective it has been. We're on lockdown as everyone else is in our community, and that's difficult. We are using video conferencing as are others as a means to keep loved ones and residents and guests connected. So we're all just working real hard to keep the residents safe and connected with their loved ones. And as of right now, you all may know we have a expansion project going on. As of now, that building is still continuing. So that's, something to monitor over time.
Okay, thanks for sharing. And I'm going to call on Danny Rodriguez, who I know is with a home care provider. Danny, Danny, can you hear us? Whoops. Looks like he dropped off. Okay. All right. Let's see.
Steve, can I interrupt for one quick second?
Yeah, we've got 8 minutes because I like to finish these things right on time. Yeah.
I think we're looking not too distant future at some blood tests that are going to be able to say whether or not you've had or have not had COVID, which I think is going to be immensely helpful. There are some that are actually available in Montgomery County right now, but they are not FDA approved. So just in case you start seeing things, they kind of look a little bit like a pregnancy test, but you put a little drop of blood on it and we'll tell you if you have different types of immunoglobulins to COVID. Just beware, there's a lot of garbage out there, but there is actually going to be an FDA approved one fairly shortly, which will be super helpful, especially when it comes to staffing needs. You may want to put somebody who's had COVID with somebody who's got COVID, maybe at home. So that's the first thing. And the second thing I did want to address just quickly is if you have patients who are, or independent living folks that are going out into the parking lot to meet their family members, I don't know how appropriate it is, but it may not be unreasonable to just say, listen, you're putting everybody else at risk. If sort of somebody to get real brave and go out and maybe say to them, listen, this isn't fair to everyone, I don't know. That's just my personal thing. I think we're at a time now where it's not totally inappropriate to call a few people out. That's my thought.
Yeah. Now, Kevin, can anybody be added to the Lifespan Daily Updates?
Yes. So Anne-Marie, if you want to just send me an email, anyone who's interested in being added, send me an email. I'll type my email address in the comments section, and we'll be happy to add you to that list. So you'll start getting things from us beginning tomorrow.
Yeah, and I'll send it out to you on the follow-up email. Let's see. Yeah, Amy, I guess you don't have any, let's see, here's a home care agency. Assisted Hands Home Care has set up new protocols questionnaire for both family and caregiver, reminders, supplies for best practices. Okay. Yeah, the whole screening, home health agencies are limiting visits. Those of people who have kids, this is interesting. A skilled nursing facility is using a website called Sign Up Genius to help schedule dates and times for staff to assist with video chat. All of us with kids are familiar with Sign Up Genius. It's interesting to see some of this technology to organize volunteers for soccer teams is now being transferred to elder care. Let's see. And we will, for everybody, we're going to send out info on all of this stuff to you. So we've got about 5 minutes left. I want to just remind folks of a bunch of things. Number one, we're gonna follow up with everyone with the slide deck, with the contact info for everybody that's on here. I'm also going to send a link to the ProAging online community. I recommend that everybody join this because it's a great way. If you've got a challenge, throw it out there. We got to work as a community to get through this. And the exciting thing, there's a lot of negative stuff out there, but the exciting thing is we're coming together better than we ever have in my 30 years in this field. This crisis is bringing us together so that we're communicating in different ways. We're trying to do things. We're way less risk averse than we've always been. This industry's always been super risk averse. We're taking calculated chances, not on health and safety, that's for sure, but on other practices that we never would have done a year ago. And so let's all come together and we're going to come out of this much stronger, and the support that we're going to be able to give to older adults and their loved ones is going to be much better. So I would say that let's see, some great comments there on the comment section. So we got a couple of minutes. Panelists, do you have anything that you want to add before we end the meeting? Wow. Again, guys, I'm really thrilled at the turnout that we had today. This was, I felt, a very good dialogue. I think everybody got the opportunity to share. And again, we'll probably have a couple of really good webinars next week. And Amy and Dr. Alex are going to do one. And then just to give you kind of a little advance on one that I've got planned. Some of you guys know Dr. Bill Thomas, the founder of Eden Alternative and the Greenhouse. He did a podcast yesterday on senior housing news, and on our online community, it really got people charged up. Just some of the things that he shared that he's thinking about. And so one of the things that we're thinking about is doing a webinar kind of centered around the podcast that he did. So everybody listens to the podcast, and then we kind of come together and do a little bit of brainstorming on what the future of senior living services could be like. So that's it. It's 1 o'clock. Enjoy the rest of your day, guys, and we'll be following up with you soon. And thank you so much for our panel members for your contributions today.
Of course. Thank you, Steve.
Thank you, Steve.
Thank you.
All right, guys.
Appreciate
See ya.
coordinating.
You bet.